Hi, my name is Megan Gallagher. I'm a certified registered medical assistant and have been for the past 7 years. What I'm here to show you today is the visual perception test. And a visual perception test is how we check the patient's vision. The reason why we do this in a family practice is because we have children coming in for school physicals, we have teenagers coming in for physicals, and we also have FAA pilots coming in for physicals so that they can fly planes. So when we do the eye exam, it's actually called the Snellen chart, and it was developed by Herman Snellen, who was a Dutch ophthalmologist back in 1862. And it's really, really cool because still 150 years later, we're still using the chart. Here's your Snellen chart, or otherwise your visual perception chart. It's very, very easy. It's just basic letters, and it goes from lines 1 all the way down to lines 11. What you do is you have your patient stand 20 feet away from you. You have them cover their left eye, and you ask them to start at line 1 and read the line from 1 all the way down to 11. Then you have your patient cover their right eye. Give them a minute to let their eye readjust so that they're able to see. Then again, you start from line 1, working your way all the way down to line 11. You want your patient to see if they have 20/20 vision, which is your baseline vision. Anything below 20/20 vision, 20/10 is exceptional vision. If your patient is only able to read up to 20/70 or 20/40, that's when we know that there's an issue and they're going to have to go see an optometrist. You want to also watch your patients as they're doing this to make sure they're not squinting or they're not inching up to see further. Then you have your children or your young teenagers that think it's cool to wear glasses and they want to wear glasses. So they'll sit there and they'll say, no, I can't read that line, or I can't see that line. You always want to encourage your patients. Okay, now we have our patient here with us. The first thing that we want to do in any procedure in the medical field, though, before we even have our patient, is wash our hands. So I've already washed my hands. The next thing I want to do is greet and identify my patient to make sure that I have the correct patient. We want your patient to feel comfortable. So, hello, Eileen. My name is Megan, and I'm going to be your medical assistant today. How are you?
Good, how are you?
I'm very well, thank you. What we're going to be doing is checking your vision. Now, I see that you're wearing glasses. Now, you see that the patient actually has glasses on. What we want to ask the patient to do is to remove their glasses. If the patient comes in and they don't have glasses on, we still want to turn around and ask them if they have contact lenses in. If they do have contact lenses in, they need to come out. So now what we're going to do is we're going to ask the patient to remove their glasses or to remove their contacts. We're going to ask the patient to cover their left eye. So, Ms. Haas, I need you to cover over your left eye. And then what we're going to do is I'm going to walk over here, I'm going to point to the lines, and you're going to read the line for me. All right, and we're going to see where your vision stands in your left eye. All right, can you read line 1 for me, please?
Sure. It's E.
And how about line 2?
F. P.
And how about line 3?
T. O. Z.
And how about line 4?
L. P. E. D.
And line 5?
P. E. C. F. D.
And can you read line 6? Okay, you're unable to read line 6. So as you can see, I was watching my patient as she was doing her test to make sure that she wasn't squinting and that she wasn't moving herself up forward. So in her left eye, she has 20/40. So we go over to the patient's chart and we document left eye 20/40. Then we go ahead and ask the patient to please cover your right eye. Okay, and we're going to start all over again. Go ahead and read line 1.
E.
And how about line 2?
F. P.
And line 6?
E. D. F. C. Z. P.
Very good. And are you able to tell me what color this is?
Green.
Green. And how about line 7?
F. E. L. O. P. Z. D.
Very good. Your right eye seems to be much better than your left eye. How about, can you do 8? We're going to give 8 a try.
I'll try. D. E. F. P. O. T. E. C.
Excellent. Very, very good. And can you tell me what color this is?
Red.
Very good. And how about line 9? Are you able to read line 9 for me? 9? No? Okay. So we'll go over to the chart and we'll document that the patient has 20/20 vision in her right eye. And if you notice how I was encouraging the patient, it gives them more self-confidence in what they're doing and it makes them feel more comfortable. And that's what you want your patients to feel, is to feel comfortable and to be at ease when they're working with you. Okay? Now, I don't need you to cover either one of your eyes. We're going to check with both of your eyes without covering either one of them. And we start again from the very beginning. Go ahead and read line 1, and how about line 2?
FP.
Now, when you're doing this with your patients and you see that your patients are able to read line 4, it's okay to go ahead and skip a line. Go ahead and read line 6 for me.
EDFCZP.
What color is this?
Green.
All right, and how about line 7? No. Okay, so we noticed that the patient stopped at line 7, or is not able to read line 7. She finished at line 6, so she has 20/30 vision in both of her eyes. And then we go ahead and document in the chart that the patient has 20/30 vision in both of her eyes. Hi guys, it's Megan Gallagher and I'm back again to talk to you about the color deficiency test. And it's almost similar to the Snellen test, but this one, what we're checking is the patients with color deficiencies. It's called the Ashira book, based off of Dr. Ashira, who's out of the University of Tokyo. And what this test does, it uses colors and patterns to determine whether or not the patient is colorblind. So now you know about the book, and let's go ahead and get started. Okay, now what we're going to do is we're going to test the patient for their color blindness. Again, with any medical procedure, you have to wash your hands, and with this procedure, you have to put gloves on. So as you can see, I've already washed my hands and I have my gloves on in place. So what we do is we open the book and we have the patient read and follow the colors. Basically how it starts out is with the green and the orange, which are common color deficiencies in patients. And what we're going to do is we're going to ask the patient to read the number for me. Can you read the number for me, please?
12.
Okay, very good. And then the next number.
8.
And how about that number?
5.
So, you just saw how easy it was to perform a color deficiency test. The Ashira book is commonly found in most medical facilities to test for color deficiency. If you yourself are colorblind, you're unable to administer the test, so you have to get one of your coworkers to help you out. Also, you have to make sure that you remember to document everything into the patient's chart. And once everything is documented, you're done and you're finished. Hi guys, it's Megan Gallagher again, and I'm here to show you how to instill eye drops into a patient's eye. Now the reason why we would be putting eye drops into a patient's eye, let's say they have conjunctivitis, which is also known as pink eye, or if they have glaucoma, which means they have pressure on their eye, or if we need to dilate their pupils for further eye examination. Now this procedure is very, very easy, and it's a very simple procedure, but you also have some patients who don't like things being put in their eyes, present company included. Okay? So what we have to do is we have to make sure that we ease our patient, make them feel comfortable, and relieve any anxiety that they may have. Okay, so for this procedure, we only need a couple things. We need our gloves, of course. You know that before you touch a patient, you always have to have your gloves on. The medication, as directed by the doctor, which normally comes in a bottle shaped like this, and gauze pad to wipe up any excess medication that should drop from the patient's eye. Okay, so with any procedure that we're going to start, the first thing that we do is wash our hands and put our gloves on. As you see, I've already washed my hands and I placed my gloves on. Okay, the next thing that we're going to do is we're going to greet and identify the patient and explain the procedure to the patient. Hi Eileen, my name is Megan and I'm your medical assistant today. How are you?
Good, how are you?
Good. The doctor has informed me that you have pink eye in your left eye and he wants me to instill 2 drops of medication into your eye, okay? Now, you may feel a little bit of a burning sensation, which is normal to feel. All right, after I install the drops in your eyes, you're going to close your eye and you're going to move your eyeball around a little bit to get the medication to go through your eye and get rid of that infection that's going on in there, okay? So go ahead and take your glasses off. I'll take them for you. So what we do is we go ahead and we get the medication as directed by the doctor. We take our piece of gauze, we have the patient sit back. All right, what I need you to do is look up for me. Holding with the gauze, hold down the eyelid and you instill the drops, not touching the cornea. Have the patient close their eye, wipe away any excess medication that should fall from the patient's eye. Return the lid, put the lid back on the medication, throw your gauze away and throw your gloves away, and the procedure's done. pretty easy stuff now, wasn't it? The main thing that we want to make sure is that our patient is comfortable and relaxed. You have to remember that your patients are very, very sensitive when it comes to their eye area, so you want to instill the medications quickly and confidently due to the fact that the patients can be very, very anxious. So we want to reduce any stress or any anxiety that the patient may be feeling. One.
I can't do that.